Hey everyone, welcome to another deep dive.
Yeah.
Today we're looking at something that might be on your mind, especially if you're in those golden years. Um, Bronchoscopy and bronchoalveolar lavage.
Yeah.
We're going to break down exactly what those are, how to get ready for them, what you might feel during the procedure, and of course what those results might reveal. We've got a ton of great sources lined up to guide us. Government health resources, medical encyclopedias, and even some knowledge bases from the pros.
Yeah, it's always good to be here. I think these procedures sometimes they can sound a little intimidating, but they're really valuable tools for diagnosing and treating a whole range of lung conditions, and especially as we age.
So let's just get right to it. What exactly are we talking about here?
Well, you can imagine this thin, flexible tube. It's called a bronchoscope, and it's got this light and a tiny camera right on the end. And it's gently guided, through your nose or mouth, down your throat, and right into your airways.
So it's like sending a tiny submarine down into the lungs.
You got it. That's a perfect way to think about it. And that camera, it gives the doctor a real-time view so they can see anything that looks unusual. Now, there's also this less common type. It's called a rigid bronchoscope. And, well, as the name suggests, it's not as flexible, and it's usually used for more complicated situations where you need bigger instruments maybe to remove a blockage or something.
Okay, so we've got the flexible, kind of like the everyday explorer, and then the rigid one for those tougher jobs. I got it.
Yeah.
So where does this bronchoalveolar lavage come in? That lung car wash we've been hearing about.
Exactly. So right during a bronchoscopy, doctors, they can perform a lavage by just gently washing a small section of the lung with this sterile saline solution. And then they collect that solution and analyze it, looking for infections, inflammation, or other clues about what's going on.
So the bronchoscope lets them see, and then the lavage is like taking samples. It's like a detective duo for your lungs.
That's exactly it. And this combination, it's especially important for older folks. As we age, things change in our lungs and we might be more susceptible to certain conditions. So this can really help get to the bottom of things.
Makes sense. So let's talk about why someone might need these procedures, especially as we get older.
It's interesting. Our bodies change as we age, right? And our lungs are no exception. They might become a little less elastic and we might produce more mucus. But sometimes these changes, they can actually kind of mask some other underlying conditions or new symptoms might pop up that need a closer look.
So it's not just about routine checkups. It's more about, really investigating those coughs or breathing troubles or other things that just don't seem quite right.
That's it. Actually, one of our sources was saying that persistent coughs, those are one of the most common reasons older adults are referred for a bronchoscopy.
Interesting. I wouldn't have thought of that. So a cough that just won't quit, that's definitely a sign to get things checked out, especially later in life.
For sure. It's always better to err on the side of caution. And in addition to coughs, things like shortness of breath, wheezing, coughing up blood, those are all things that should be taken seriously.
Yeah, those sound pretty alarming.
They can be, and they're often signs that something's not right. In older adults, those symptoms could indicate a whole bunch of things, from infections like pneumonia to COPD or even lung cancer.
Wow, so those are some serious red flags. So if you're experiencing any of those symptoms, especially if they're new or getting worse, it's really crucial to see your doctor right away.
Absolutely. Early diagnosis is key. And these procedures, they can help pinpoint the cause of those symptoms and then guide those treatment decisions.
So we've talked about why someone might need a bronchoscopy or a lavage, but I think a lot of people, especially older adults, they might be feeling pretty anxious about the actual procedures themselves. So can we walk through what actually happens? Step by step?
Of course. It's totally normal to feel that way. Let's break it down. So first, you'll need to fast for a certain period of time before the procedure. Your doctor will give you specific instructions. This just helps prevent any complications. Then you'll get some medications to help you relax and numb your throat.
Oh, so you're not going in there totally aware of everything happening.
No, not at all. The medications, they make the whole experience much more comfortable. And while you'll be awake for the procedure, you probably won't remember much of it afterward. Plus, with that local anesthetic, you might feel some pressure, but it shouldn't be painful.
Okay, that's good to know. So you're relaxed, your throat is numb. What happens next?
Well, the doctor will gently insert that bronchoscope through your nose or mouth and guide it down into your airways. And they'll use that camera to examine everything. And if they need to, they might take a small tissue sample. It's called a biopsy.
And what about if they're doing a lavage?
Right. So for the lavage, they'll introduce that saline solution I mentioned through the bronchoscope and gently wash the area. Then they suction the fluid back out to collect a sample.
So really is like a gentle rinse to gather those clues.
You got it. And the whole procedure usually takes less than an hour. And afterward, you'll be monitored in a recovery area for a few hours until those medications wear off.
This is all starting to sound much less intimidating than I originally thought.
It's really not as bad as it sounds. And, one thing that one of the sources mentioned was how important it is to have a friend or family member there with you during the procedure. Just their presence can be really comforting, especially for older adults.
That's a really good point. Having someone there to hold your hand and just offer some reassurance can make a world of difference.
Absolutely. It's all about feeling safe and supported through the whole thing.
So we've covered the what and how of the procedures. But what about the after? What can people expect during that recovery period? What should they be prepared for?
That's a great question, and it's especially important for older adults who might need a little more time to bounce back. So let's dive into that. Right after the procedure, you'll probably feel some numbness in your mouth and throat. It's totally normal. And you'll need to avoid eating or drinking anything until that numbness wears off, usually a couple of hours.
So no snacking right away. What else should people be ready for during those first few hours?
Well, you might have a sore throat or a cough or even some hoarseness for a day or two. It's kind of like recovering from a little cold.
Yeah, makes sense.
Yeah.
Got to give those vocal cords a break.
Exactly. And of course, if you had those sedatives, you'll need someone to drive you home and, no operating heavy machinery for the rest of the day.
Safety first. Always important. Now, for our listeners who are a bit older, are there any extra recovery tips that might be particularly helpful for them?
One of the sources really emphasized staying hydrated, especially for older adults. It helps thin out any mucus, making it easier to cough up and clear those airways.
That's a great reminder. Staying hydrated is always good advice, but especially important after a procedure like this.
Absolutely. And it's also super important to rest. Avoid any strenuous activity for a few days. Listen to your body and give it time to heal.
Take it easy, stay hydrated, let the body do its thing.
Got it.
Yeah.
Now, what about those results? After all that prep and the procedure itself, I'm sure everyone's eager to know what it all means.
Right. Well, the results are always interpreted in the context of your overall health, taking into account your symptoms, medical history, and any other test results. But generally, a bronchoscopy can reveal things like obstructions in your airways or growths or any narrowing or inflammation.
And what about the lavage? What kind of information does that give?
So the fluid that we collect during the lavage, we can actually examine it for all sorts of things, bacteria, viruses, fungi, even cancerous cells. It's really valuable for diagnosing a wide range of lung conditions. Wow. So it's not just a visual check. It's like getting a microscopic peek inside the lungs. Now, for older adults, are there any normal findings that we might see that wouldn't necessarily be a cause for concern?
That's a really important point. One of the sources mentioned that even in healthy older adults, we might see some age-related changes in the airways. Maybe a little decrease in elasticity or a bit more mucus than in younger folks. And these are considered normal variations.
So it's about distinguishing between those normal signs of aging and signs of actual disease.
Exactly.
Okay.
And that's why it's so important to have a skilled medical team interpreting the results.
Yeah.
They'll consider your individual health history and everything to make an accurate diagnosis.
That makes a lot of sense. On the other hand, what are some of those abnormal findings that might be a red flag, particularly in older adults?
Well, like we talked about before, older adults are at higher risk for certain conditions, things like pneumonia and lung cancer. So finding any suspicious growths, areas of inflammation or signs of infection, those would definitely warrant further investigation.
And those findings may be handled differently in an older adult compared to a younger person, right?
Yeah. Treatment plans are always tailored to the individual, but age is definitely a factor. An older adult might have other health conditions that could affect how they tolerate certain medications or procedures. So it's all about finding that right balance between addressing the lung issue and managing their overall health and well-being.
Sounds like a collaborative process. The patient, their loved ones, and the healthcare team all working together.
Absolutely. Open communication is key throughout the whole process. From discussing any concerns before the procedure to understanding the results and coming up with a treatment plan that works for you.
This has been so helpful in really understanding the nuances of these procedures, especially for older adults. It's clear that knowledge and communication are so important.
I couldn't agree more. The more you know, the more empowered you'll feel throughout the process.
Okay, so before we move on, I have a question that I think a lot of our listeners might be wondering about. We've talked a lot about the physical side of bronchoscopy and lavage, but what about the emotional side? I mean, these procedures, especially for someone facing health challenges maybe for the first time, can be really anxiety-inducing.
You're absolutely right. It's completely normal to feel anxious or apprehensive about going through these procedures. And it's especially true for older adults who might be dealing with other life transitions or health concerns on top of everything else.
So how can we as friends, family members, or caregivers, how can we best support our loved ones who are going through this and dealing with those emotional challenges?
I think one of the most important things is just to acknowledge and validate their feelings, let them know it's okay to be scared or overwhelmed. Just having that validation can make a huge difference.
Absolutely. Just knowing you're not alone in those feelings.
Exactly. And encourage them to talk about their fears and concerns with their doctor, with their loved ones, with a therapist, whoever they feel comfortable with.
So open communication again, just like with the medical aspect?
Exactly. And one of our sources highlighted the importance of focusing on the individual's strengths and resilience. Remind them of the challenges they've overcome in the past and the resources that they have available to them.
That's a great point. It's about empowering them to face this challenge head on.
Exactly. And don't underestimate the power of those simple gestures. Offering a listening ear, being present, helping them connect with support groups or online resources, whatever they need.
These are all such valuable suggestions. It really highlights the fact that healthcare is about so much more than just treating the physical symptoms. It's about the whole person.
I completely agree. It's a holistic approach that recognizes how our physical, emotional, and social well-being are all interconnected.
Well said.
Yeah.
Now, I know technology is advancing rapidly in all areas of medicine. So are there any new developments in bronchoscopy and lavage that our listeners should be aware of?
That's a great question. And it's the perfect segue into our final segment. Let's talk about those cutting-edge advancements. So yeah, there's been some really remarkable developments in bronchoscopy technology, making the whole procedure even less invasive and way more comfortable for patients.
It's always good to hear. Less invasive usually means a faster recovery, right?
You got it. And one of the really cool things is the development of what they call ultra-thin bronchoscopes. So these are incredibly slender scopes that can get into even those tiniest airways with, minimal discomfort.
Wow, that's amazing. Are there any other benefits to these new scopes besides just being thinner?
Oh, yeah, definitely. One of the sources actually mentioned that these ultra-thin bronchoscopes, they often have all this advanced imaging technology built right in, things like high-definition cameras and even ultrasound capabilities.
Wow, that's incredible. It's like giving doctors X-ray vision for the lungs.
It really is. And this level of detail allows for much more precise diagnosis and treatment, especially in those hard-to-reach areas, For older adults who often have more delicate airways, these advancements can be a real game changer.
It sounds like they're really trying to make these procedures as safe and as comfortable as possible for everyone. So are there any other advancements, on the horizon that you're particularly excited about?
Well, there is one that I'm really interested in, and that's the use of artificial intelligence in lung diagnostics.
AI and lung diagnostics. That sounds pretty futuristic.
It might sound like something out of a sci-fi movie, but it's actually becoming a reality pretty quickly. Researchers are developing these AI algorithms that can analyze images and data from these procedures, and they can potentially spot those subtle patterns that even the most experienced doctor might miss.
That's incredible. What are some of the potential benefits of using AI in this field?
Well, just imagine, AI that could predict how likely someone is to develop certain conditions based on a whole bunch of factors. Or AI that could tell the difference between, harmless age-related changes and actual signs of disease and do it with incredible accuracy.
That's amazing. It sounds like AI could really revolutionize the way we approach lung health.
Yeah.
Leading to earlier diagnoses and treatment plans that are truly personalized.
I think it has the potential to do exactly that. It's a really exciting time to be working in this field, and I'm optimistic about the positive impact these innovations will have on patients.
Well, this has been a fascinating deep dive.
Huh.
We've gone from the basics of bronchoscopy and lavage to those cutting-edge advancements and even explored the emotional side of things. It's been incredibly informative.
It's been my pleasure. I hope our listeners are feeling more knowledgeable and empowered to have these conversations with their healthcare team.
Me too. Remember, everyone, knowledge is power when it comes to your health. The more you understand, the better equipped you'll be to make those informed decisions and advocate for yourself. And of course, don't forget, you're not alone. There are so many resources out there to support you, from healthcare professionals to online communities to support groups. Reach out, connect, and keep learning. Thanks for joining us today, and until next time, stay curious and stay well.